1. When teaching new orthopedic technologists proper cast application, which adult learning principle is most effective for ensuring skill retention? A. Providing extended reading material only. B. Demonstrating followed by supervised practice. C. Assigning independent research projects. D. Requiring memorization of textbook content. 2. During a skills evaluation of traction setup, which method best measures both competence and adherence to safety protocols? A. Written multiple choice test. B. Peer self-assessment checklist. C. Direct observation with standardized rubric. D. Oral questioning session. 3. In developing a curriculum for orthopedic technologist trainees, which instructional sequence aligns with adult learning needs? A. Theory first, then unrelated practice scenarios. B. Immediate clinical immersion without foundation. C. Concept explanation followed by real-world application. D. Passive lectures without skill application. 4. When mentoring a novice technologist in brace fitting, which approach encourages critical thinking and autonomy? A. Provide immediate corrections without explanation. B. Allow independent problem solving with guided feedback. C. Perform the task entirely for the trainee. D. Offer only written instructions without demonstration. 5. A regulatory compliance audit requires orthopedic technologists to demonstrate sterile technique. Which evaluation method ensures objective assessment? A. Group discussion. B. Peer voting. C. Structured skills checklist with observer scoring. D. Multiple choice written test. 6. Which communication strategy is most effective when instructing patients about post-cast care? A. Using technical jargon to maintain professionalism. B. Providing written and verbal explanations with teachback. C. Relying solely on a printed instruction sheet. D. Giving brief verbal directions without clarification. 7. In designing an assessment for splint fabrication, which principle ensures reliability across different evaluators? A. Allowing subjective scoring. B. Creating a standardized rubric with clear criteria. C. Permitting evaluators to use personal judgment. D. Providing no scoring guidelines. 8. When orienting technologists to a new regulatory policy, what instructional method maximizes adult learner engagement? A. Passive lecture with no interaction. B. Policy reading assignment only. C. Case-based scenarios illustrating policy application. D. Memorization drills of policy language. 9. During cast removal training, what mentoring technique promotes long-term competence? A. Performing the task while the trainee observes only. B. Giving hands-on practice with immediate corrective feedback. C. Critiquing performance without demonstration. D. Allowing repeated errors without intervention. 10. When teaching adult learners about orthopedic device safety checks, which principle is critical for retention? A. Passive listening. B. Immediate relevance to patient safety outcomes. C. Abstract memorization of device parts. D. Delayed practice opportunities. 11. Which evaluation tool best aligns with regulatory compliance in orthopedic technologist continuing education? A. Informal peer discussion. B. Open-ended reflective journal. C. Competency-based performance exam. D. Attendance-only sign-in sheet. 12. When facilitating a curriculum module on external fixators, which instructional method best supports adult learners? A. Sole reliance on textbook diagrams. B. Role play and simulation of device application. C. Verbal lecture only. D. Written test without demonstration. 13. During peer mentoring, which feedback technique enhances reflective practice? A. Giving generic, positive comments. B. Highlighting specific behaviors with constructive suggestions. C. Focusing only on errors without solutions. D. Avoiding feedback to promote independence. 14. When teaching patient positioning for fracture reduction, which method respects adult learners' experiential knowledge? A. Asking learners to share prior clinical experiences. B. Ignoring learners' background knowledge. C. Delivering scripted instructions only. D. Relying exclusively on instructor demonstration. 15. What is the most effective way to evaluate a technologist's ability to communicate cast care to a patient? A. Written exam with terminology definitions. B. Role play observed with standardized checklist. C. Peer-graded group discussion. D. Patient self-assessment survey. 16. In curriculum development, how can orthopedic technologist instructors ensure alignment with regulatory standards? A. Incorporate current laws and accreditation requirements into objectives. B. Use outdated materials for consistency. C. Rely on instructor preference alone. D. Focus only on clinical skills without compliance context. 17. Which mentoring approach is best for supporting a struggling technologist in learning traction principles? A. Provide incremental challenges with guided feedback. B. Avoid assigning tasks to prevent errors. C. Offer criticism without follow-up. D. Assign independent reading only. 18. What strategy best promotes communication effectiveness when training technologists on documentation practices? A. Emphasize legal importance with real case examples. B. Skip explanations and require memorization. C. Allow subjective variation without standards. D. Provide only verbal instructions. 19. When assessing cast complication recognition, which method demonstrates higher-order critical thinking? A. Asking learners to recall definition of compartment syndrome. B. Presenting case scenarios requiring decision-making. C. Testing on basic cast materials. D. Giving vocabulary matching exercises. 20. Which instructional strategy promotes regulatory compliance awareness in orthopedic technologists? A. Simulation drills replicating compliance situations. B. Optional, non-graded policy review. C. Pure lecture without interaction. D. Handouts only. 21. When teaching splinting, which evaluation method ensures both psychomotor and cognitive skill assessment? A. Written multiple-choice exam only. B. Direct observation with rationale questioning. C. Peer opinion survey. D. Patient satisfaction rating. 22. In mentoring new technologists, which approach fosters professional growth? A. Encourage self-reflection and goal setting. E. Provide constant correction without autonomy. C. Avoid discussions of career progression. D. Assign repetitive tasks without variation. 23. Which principle of adult learning is most important when teaching orthopedic technologists to use new traction equipment? A. Relevance to clinical practice. B. Emphasis on rote memorization. C. Ignoring prior clinical experience. D. Extended theoretical lectures only. 24. What is the best way to evaluate understanding of ethical considerations in orthopedic technology? A. Multiple choice exam with isolated facts. B. Case study analysis with structured rubric. C. Peer group voting on decisions. D. Open discussion without grading. 25. Which communication strategy helps technologists explain immobilization procedures effectively to pediatric patients' parents? A. Use clear, empathetic language with visual aids. B. Rely on medical jargon exclusively. C. Provide minimal explanation to reduce time. D. Skip explanations if parents appear anxious. 26. In designing a continuing education workshop, which component ensures alignment with curriculum development standards? A. Learning objectives linked to practice competencies. B. Random selection of unrelated topics. C. Emphasis only on instructor preference. D. Avoidance of measurable outcomes. 27. When evaluating skill in orthopedic traction setup, which rubric element ensures fairness? A. Clear criteria with performance descriptors. E. Flexible scoring depending on instructor mood. C. Subjective rating scales only. D. Eliminating standardization. 28. What is the best mentoring technique to enhance trainee confidence in cast removal? A. Gradual increase in responsibility with supervision. B. Immediate independent practice without oversight. C. Avoiding opportunities to practice. D. Criticism without encouragement. 29. In adult learning, which instructional design principle maximizes retention of orthopedic safety standards? A. Active problem-solving activities. B. Long passive lectures. C. Memorization without application. D. Repetition without context. 30. Which evaluation tool is most effective in assessing a technologist's ability to identify skin complications under casts? A. Multiple choice exam only. B. Objective structured clinical examination, OSCE. C. Peer group debate. D. Instructor opinion survey,